Hi everybody, welcome to PharmaExplora. Today we are going to discuss one of the most important concepts in pharmacy field. We can also say this is the foundation or the bedrock of pharmaceutical sciences. So without further ado, let me tell you what we are going to discuss today. Today we are going to discuss about what is pharmacology. And what does this term pharmacology actually means? Where did it origin? And what are the basic principles of pharmacology? Or what are the basic fundamentals of pharmacology? So on and so forth. So pharmacology is the foundation of most of the pharmaceutical sciences. No matter whether you are a student, whether you are a healthcare professional, or a person who is simply interested about learning to how medicines work inside our body, this is where it all begins. So let's get started. Okay, now we are going to discuss what is pharmacology. So pharmacology is basically defined as the science of medicine, including its origin, composition, and interaction with biological systems. So pharmacology we define as the science of medicine. Science of medicine, including its origin, in other words source, and the composition, in other words what it is made up of, and also interaction with biological systems. So pharmacology we formally define as the science of medicine, including its origin or the source, and the composition or what it is made up of, and also most importantly interaction with biological systems, or in other words how it is going to act inside our body. So we can further elaborate this pharmacology as the branch of medicine and biology where we learn about action of medicine. So we can further elaborate this field as branch of medicine and biology. So we can further elaborate as the branch of medicine and biology. Biology, where we learn about the action of the medicine. Where we learn about the action of medicines. Okay, so pharmacology we formally define as the science of medicine, where we learning about the origin or the source and the composition, what it is made up of, and most importantly interaction with biological systems, or in other words how it is going to act inside our body. Then we further elaborate pharmacology as the branch of medicine and biology, where we are learning about actions of medicines. So under pharmacology, we are learning medicines, origin, under pharmacology, we are learning about medicine's origin, physical and chemical properties, biochemical effects, as well as physiological mechanisms. So, we are learning about medicine's origin, physical and chemical properties, biochemical effects, as well as physiological mechanisms. Physiological mechanisms. So you can see under pharmacology, we are learning about medicines, origin, physical and chemical properties, biochemical effects, as well as physiological mechanisms. So you can see here we are learning about medicine's birth to its final action. So under pharmacology, we are learning medicine's birth to its final action. Since we are learning about medicine's birth to its final action, we can also say under pharmacology we are learning about the biography of the medicine. Biography of a medicine. Okay, so pharmacology we define as the science of medicine, including its origin, composition, and interaction with biological systems. We further elaborate pharmacology as the branch of medicine and biology, where we are learning about action of medicines. So under pharmacology, we are learning about medicine's origin, physical and chemical properties, biochemical effects, as well as physiological mechanisms. Since we are learning from medicine's birth to its final action, we can also say under pharmacology, we are learning biography of the medicine. Now we are coming to the most important part. So what is the most important part in learning pharmacology, or the ultimate goal of learning pharmacology is to use medicine safely and effectively. So that is the most important thing we have to keep in our mind. So the ultimate goal of learning pharmacology is to use medicine safely and effectively. So the ultimate goal of learning pharmacology is to use medicine safely and effectively. So to summarize, we define pharmacology as the science of medicine. So including its origin or its source and composition, what it is made up of, and also interaction with biological systems, or how it is going to act inside our body. Then we further elaborate pharmacology as the branch of medicine and biology, where we learn about the action of medicines. And under pharmacology, we are going to learn about origin, medicine's origin, physical and chemical properties, biochemical effects, as well as physiological mechanisms. So as we are learning from its birth to the final action, we can also say under pharmacology, we are learning about the biography of a medicine. And also, finally, the most important part, the ultimate goal of learning pharmacology is to learn how to use medicine safely and effectively. So, that is the most important message that we have to keep in mind when we are learning pharmacology. How this knowledge we are going to use to use medicine safely and effectively. So, this is what pharmacology is. In our previous session, we have discussed what is pharmacology. So, in that session, we have defined the pharmacology as the science of medicine, including its origin, composition, as well as the interaction with biological systems. So, we further elaborate this pharmacology as the branch of medicine and biology where we learn about the action of medicines. So also we discussed the under pharmacology we are going to discuss about the origin of the medicine, by the physical and chemical properties of a medicine, biochemical effects of the medicine, as well as physiological mechanisms. And also finally we concluded that the ultimate goal of learning pharmacology is to have the knowledge to use medicine safely and effectively. So now we are going to take one famous medicine or the drug as an example and going to discuss what pharmacology of this particular medicine is. So this medicine is a very famous one, the penicillin. So this is called wonder drug. This was discovered by Sir Alexander Fleming in 1928. Since then, this medicine saved millions of lives from life-threatening infections. So let's start now. Under pharmacology, so pharmacology, we are going to learn not only about a pill or injection of penicillin. We are going to learn about the entire life story or the biography of the penicillin. So, we are going to learn about the origin, then physical and chemical properties, chemical properties, then biochemical effects, as well as physiological mechanisms. Physiological effect. Also, we are going to learn about use of safe and effective way of this medicine. Safe and effective. So our example is famous penicillin. This is our example. So we are going to discuss the pharmacology of penicillin for you to understand what is pharmacology. So penicillin is antibacterial drug. So first let's discuss the origin or the source. That means where did it come from? That means when it comes to medicines, pharmacologists concerned about its source. It can be sometimes either synthetic or sometimes it can be either natural. So in our example, penicillin, Sir Alexander Fleming was discovered this penicillin on a petri dish, the mold on a petri dish, which was identified later as Penicillium notatum. So it is a fungi. So the origin of the penicillin is natural. And then come to the physical and chemical properties. So physical and chemical properties means what? That is, how does this particular drug molecule behaves? So knowing how this particular drug molecules behave is very much important to get the proper therapeutic response. So knowing the drug's personality is kind of very important. So these physical and chemical properties, when it comes to the physical and chemical properties of penicillin, there are two important things we have to know. Two important properties. First, let's put the origin, natural. Then, when it comes to the physical and chemical properties, the first property is they have beta-lactam ring. This beta-lactam ring is the specific chemical structure which gives the penicillin, which gives the power to penicillin to kill the bacteria. So this is very important. This beta-lactam ring, the chemical structure of the beta-lactam ring is the uh, most important part in this penicillin drug molecule. And also, some versions of penicillin are acid labile. So they are sensitive to acid. Some versions of penicillin are acid labile. That means they can be destroyed in stomach acid. So such penicillins we are giving as injection. So why? Because giving it in through mouth in oral form does not going to be effective. So the acid sensitive penicillins are there. In such cases we are giving that through injection. So these are the physical and chemical properties. Few physical and chemical properties of penicillin are example. Then the biochemical effects. So what are we going to mean by these biochemical effects? So biochemical effect is it's like what happens at the microscopical level. So the effect that happens at the microscopical level. Now that means when it comes to the penicillin, you know, this penicillin drug molecules goes and binds to the specific target receptors, which we call penicillin binding receptors in bacterial cell, and inhibit the formation of bacterial cell wall. So the biochemical effect is this. So now the penicillin drug molecules goes and binds to the penicillin binding receptors on bacterial cell and inhibit the formation of bacterial cell. So that is the biochemical effect. What happens at the microscopical level? So that is the biochemical effect. So prevention of bacterial cell wall synthesis. So origin is the source. Where did it come from? Physical and chemical properties of a drug is how does this drug is going to behave, or what drug's personality is. The biochemical effect means how it is going to uh, behave at the microscopical level, or what happens at the microscopical level. Then physiological effect. This is the big picture. The big picture means this is the result of this microscopic level action. So this is the big picture, that means result of this microscopic level reactions. Now what will happen? Now this uh, the our drug molecule penicillin goes and binds to the penicillin binding receptors in bacterial cell, and they prevent formation of bacterial cell wall. So the bacteria do not have strong cell wall. So we know inside the bacteria the water content is very less, so they like to absorb water. So what will happen? Bacteria absorb water and they swell. Then once they swell, the cell wall is very weak, so they swell and eventually burst. So we call this cell lysis. So the bacterial cell death happens. So once the bacterial cell death happens, what will happen? The infection reduces, then the inflammation drops, and the fever reduces. So the physiological effect is the reducing the infection. So that is the big picture. So that is the physiological effect. So now hope you can understand. So the pharmacology, under pharmacology of penicillin, we discussed the origin, physical and chemical properties, biochemical effects, as well as physiological effects. But the ultimate goal of learning pharmacology is to know the safe and effective use of medicine. So when it comes to penicillin, there are two important things that we have to keep in mind. This penicillin can cause severe allergic reactions in some of the patients. So this penicillin can cause severe allergic reactions. So for those patients, this medicine cannot be used. So penicillin is effective against for the patients who are not allergic to penicillin. And also there is another thing, misusing this medicine can cause antibacterial resistance. So it is very important for the patient to use this medicine throughout the prescribed throughout entire prescribed duration to avoid developing the resistance for this penicillin. So bacterial resistance. Okay, now I hope you understand. So pharmacology we defined as the science of medicines, where we learn about the origin, the composition, as well as interaction with biological systems. So we further elaborate pharmacology as the branch of science, the branch of medicine and biology, where we learn about the mechanisms of action of medicines. So under pharmacology, we are going to learn about origin. Not under pharmacology, we are not just learning the medicine's name and its form and its indications. We are going to learn about its entire life story, the origin, physical and chemical properties, biochemical effects, as well as physiological effects. So since we are discussing here from birth to its final action of the medicine, we call, under pharmacology, we are discussing entire biography of a medicine. So here we took famous example, the famous medicine as the example and discussed the biography of particular the medicine in very short or summarized way. So penicillin is the first antibiotic discovered by Sir Alexander Fleming in 1928. Since then, it saves millions of patients from critical illnesses, critical infections. So the penicillin origin is natural. Origin means where did it come from? Is it a synthetic one or is it a natural one? So this is the natural. Then physical and chemical properties means how the drug molecules is going to behave, or in other words, drug's personality. So knowing this drug's personality is very much important for us to get the maximum therapeutic outcome. So when it comes to penicillin, it has this beta-lactam ring, special chemical structure, which provides its bacterial killing ability, and some versions of penicillin are acid labile. So we in such penicillins we are not using through mouth oral because it can be destroyed by stomach acid. And biochemical effects means what happens at the microscopical level. So when it comes to our example penicillin, these penicillin drug molecules goes and binds to the penicillin binding protein on the bacterial cell and inhibit the growth of bacterial cell wall. Then what happens, because of this inhibition of formation of bacterial cell wall, the bacteria will do not have a rigid cell wall. So bacteria, inside the bacteria, they have less water content, so they like to absorb water. So bacteria will absorb the water, then swell, and eventually, since their cell wall is very weak, they burst. This process is called cell lysis, so the bacterial cell death will occur. So this physiological effect is the reaction, result of this microscopic level action. So what will happen? The cell lysis happen. So the bacteria get destroyed. So the infection controls, then the inflammation drops and fever reduced. So that is the physiological effect. And also learning the pharmacology, the ultimate goal or the purpose is to use safe and effectively this medicine. So when it comes to the penicillin, the penicillins have severe allergic reactions against some of the patients. So when we are learning pharmacology, we know that. So we know penicillin should be used only for the patients who are not allergic to penicillin. And also, the penicillin can cause bacterial resistance when it is misused. So we know to prevent this developing the bacterial resistance, we have to use this particular medicine throughout the entire course of the prescribed period. So this is basically how we define pharmacology using the penicillin as an example. Okay, now we are going to discuss how the term pharmacology has derived. So, now we are going to discuss how this pharmacology term derived. This term pharmacology derived from ancient Greek language. So, ancient Greek language. So this term pharmacology has derived from ancient Greek language, This pharmacology derived from two ancient Greek language words. So the first one is pharmakon. And the second one is logia. So we'll discuss what are the meanings of these two ancient Greek language words. So in ancient Greek, this pharmakon word used to define a medicine or a drug as well as a poison. So it's a complex ambivalence term which simultaneously means the medicine or a drug as well as a poison. So the primary reason for this ambivalence is actually in ancient Greece they were used this term to define a substance that can alter the biological functions of a human body. That can be either the medicine or a drug as well as it can be a poison. So pharmakon is a complex ambivalence term that used to define a medicine or a drug as well as a poison. So the primary reason for this ambivalence is in ancient Greece they were used this pharmakon term to define a substance which can alter the human body functions. It can be either a medicine or a drug as well as a poison. And there is a famous suffix in Greek language, the logia. The meaning of the logia is the study of. Study of. So altogether, we can say the combining of pharmakon and logia. So the meaning of the pharmacology is the study of medicines or the study of substances that can alter the biological functions of the human body. So that is how this term pharmacology has derived from ancient Greek language. Now we are moving to the most critical part of our lecture. Now we are going to discuss the basic fundamentals of pharmacology. So the modern pharmacology is divided into two main categories, pharmacodynamics and pharmacokinetics. These two terms are the bread and butter for the pharmaceutical profession. So to make it simple, you can think of it as two sides of the same coin. So the pharmacology, now let's see, pharmacology is divided into two main categories, pharmacodynamics dynamics and pharmacokinetics. Okay, now we are going to discuss each term separately in detail. Now we are going to discuss our first pillar, pharmacodynamics. So we discussed previously, pharmacology is divided into two main categories, pharmacodynamics and pharmacokinetics. So pharmacology is divided mainly into two categories, pharmacodynamics and pharmacokinetics. So pharmacodynamics and pharmacokinetics are the two basic fundamentals of pharmacology. So now we are going to discuss the first pillar, pharmacodynamics. So this pharmacodynamics we simply define as the what drug does to the body. So to anyone to understand, we define it as what drug does to the body. So when we take medicine inside our body, what that particular medicine do to our body. So simply we define pharmacodynamics as what drug does to our body. So this is what basically pharmacodynamics is. So going into more professional context, we define pharmacodynamics as the study of biochemical effects and physiological effects of drugs on biological systems. So going into more professional context, we define the pharmacodynamics as the study of biochemical effects and physiological effects of drugs on biological receptors or on biological systems. So formally, we define the pharmacodynamics as the study of biochemical effects and physiological effects of drugs on biological systems. So this pharmacodynamics explains drugs' behavior at the molecular level. So specifically, how it interacts with biological receptors. So this pharmacodynamics explains drugs behavior at the molecular level. Specifically, its interaction with biological receptors. Okay, so in more professional context, we define the pharmacodynamics as the study of biochemical effects and physiological effects of drugs on biological systems. So we can further elaborate. It studies the drug's behavior at the molecular level, specifically interaction with biological receptors. Now we'll take an example. Suppose this is a drug receptor. This is the Suppose this is the biological receptor or the drug receptor. This is the drug molecule. So this is the drug molecule, and this is the biological receptor inside our body. So when the drug molecule binds to this biological receptor, it provides or it initiates a chain of reactions. So when particular drug molecule binds to its biological receptor, it initiates chain of reactions. Chain of reactions. Chain of reactions. This will ultimately lead to the therapeutic response. Our goal. This will ultimately lead to the therapeutic response. Now, when a drug molecule binds to its biological receptor, it initiates a chain of reactions. So, this will ultimately lead to therapeutic response. This therapeutic response can be killing a bacteria, then reducing blood pressure, reducing blood sugar, and also sometimes relieving pain, etc. So, this studying about this behavior is the pharmacodynamics. So we can also say pharmacodynamics explains the mechanism of action of a medicine, or the how and why of behind the drug's effect. So we can also say pharmacodynamics explains the mechanism of action. Where I'm going to write? Oh, here. Okay. Mechanism of action. No. Right. We will write it here. Pharmacodynamics explains the mechanism of action. Mechanism of action of a medicine, or the how and why of drugs effect on our body. So this is basically what pharmacodynamics is. So to summarize, the pharmacology we divided into two main categories: pharmacodynamics and pharmacokinetics. So this pharmacodynamics and pharmacokinetics are the basic fundamentals of pharmacology. So now we are going to discuss what pharmacodynamics is. So pharmacodynamics we simply define as what drug does to the body. So going into more professional context, we define pharmacodynamics as the study of biochemical effects and physiological effects of drugs on biological systems. To further elaborate, we explain pharmacodynamics is this drug molecule's behavior at the molecular level. More specifically, this drug molecule's behavior at the drug receptor or the biological receptors level. So, under pharmacodynamics, we study the interaction of drug molecules at the biological receptor. So, we took an example. This is the biological receptor. This is the drug molecule. So, when drug molecule binds to its biological receptor, it initiates a chain of response which ultimately lead to our primary goal of providing the therapeutic response. So this therapeutic response can be either killing a bacteria, reducing blood sugar, reducing blood pressure, or relieving pain, etc. So we can also say these pharmacodynamics explain the mechanism of action of a drug, or the how and why of drugs behind the drug's effect. So this is what pharmacodynamics is. Okay, now we are going to discuss our second essential pillar, pharmacokinetics. So, as you can remember, we discussed pharmacology divided into two main categories, pharmacodynamics and pharmacokinetics. So, pharmacology divided into two main categories. First one we already discussed, that is pharmacodynamics. Pharmacodynamics means, in simple terms, pharmacodynamics means what drug does to the body. So pharmacodynamics is what drug does to the body in simple terms. Now we are going to discuss about the second essential pillar, pharmacokinetics. Pharmacokinetics. So pharmacokinetics simply we define as what body does to the drug. So pharmacology basically divided into two main categories, pharmacodynamics and pharmacokinetics. Pharmacodynamics we previously discussed. We simply define the pharmacodynamics as what drug does to the body. So while pharmacodynamics is focuses on drug action, we define pharmacokinetics as what body does to the drug. So we simply define what body does to the drug. So what body does to the drug. So here we, under pharmacokinetics, we study the effect of biological systems on drug molecule. So under pharmacokinetics, we learn effect of biological systems on drug molecule. So this pharmacokinetic focuses on the tracking or studying the entire movement or the fate of a drug molecule from the moment it enters to our body and until it leaves our body. So this pharmacokinetic focuses on tracking down or the studying the movement or the fate of drug molecule from the moment it enters to our body and until it leaves from the body. So it tracks the movement or the fate of a drug molecule from the place it enters to the body and until it leaves the body. From it enters to drug molecule enters to our body until it leaves our body. So this pharmacokinetic is all about what body does to the drug. So Under more professional context, we define pharmacokinetics as the study of effect of biological systems on drug molecules. So, to learn pharmacokinetics, we track the movement or the fate of a drug molecule from the moment it enters to our body and until it leaves our body. So, this is a kind of complex journey where drug molecules undergo inside our body. So, to understand this complex journey, we use universal framework. We use universal framework called ADME. ADME, universal framework called ADME. So, ADME is the framework that we use to explain the movement or the movement or the fate of the drug molecule inside our body. So, ADME uh, explains absorption, distribution, metabolism, and excretion of the drug molecule. So, this universal framework of ADME explains the absorption, distribution, metabolism, and excretion of a drug molecule. So, to summarize what pharmacokinetics is, so we discussed pharmacology has two main categories, the pharmacodynamics and the pharmacokinetics. So while pharmacodynamics focuses on drug action, what drug does to the body, this pharmacokinetics focuses on what body does to the drug. So in more professional context, we define the pharmacokinetic is the study of effect of biological systems on drug molecule. So to further elaborate, we said that pharmacokinetics tracks down the movement or the fate of a drug molecule from the moment it enters to our body and until it leaves the body. So this is a very complex journey the drug molecules undergo. So to explain this journey, we use universal framework called ADME. This ADME framework we define as the absorption, distribution, metabolism, and excretion of the drug molecule. Now we are going to discuss very important ADME framework. So hope you can remember we discussed pharmacology is divided into two main essential categories, the pharmacodynamics and pharmacokinetics. Pharmacodynamics is what drug does to the body and pharmacokinetics is what body does to the drug. So, under pharmacokinetics, we learn the fate or the movement of the drug molecule from the moment it enters to the body and until it leaves our body. To explain this complex journey, we use a framework, universal framework called ADME. Now we are going to discuss that ADME framework. So, now we are going to discuss ADME framework. ADME framework. So ADME framework we can say ADME stands for absorption, distribution, metabolism, and excretion of the drug molecule. So ADME framework, ADME stands for absorption, distribution, metabolism, and excretion of the drug molecule. Now let's discuss one by one. So first step is the absorption. First step is the absorption. Absorption. So absorption is the first step where drug molecule enters to our body. So absorption is the process where the movement of the drug molecule from its site of administration to the bloodstream. So the absorption is the process of movement of drug molecule from its site of action from its movement site of administration to the bloodstream. So bloodstream. So absorption is the first step. Absorption we define as the process of movement of the drug molecule from its site of administration to the bloodstream. So absorption is the first step, very important. No matter whether you are taking an injection or you are taking a tablet or capsule, you are applying a cream, this absorption process is the first one, where drug molecule moving from its site of administration to the bloodstream. Then the second step. What is the second step? Distribution. So distribution means once the drug is absorbed into the bloodstream, it doesn't stay there. So once the drug is absorbed to the bloodstream, it doesn't stagnantly stay there. It circulates throughout our body. To reach its target tissues or fluids. So to provide therapeutic response. So distribution is the second step. Where once the drug is absorbed, it doesn't stagnantly stay there. It circulates throughout our body to reach its target tissues or fluids to provide therapeutic outcome. That is the distribution. Then the third one, the metabolism. Metabolism. Metabolism is the process how our body treats this guest or the drug molecule. So metabolism is the process of chemical transformation of the drug molecule to its metabolite. So this is most of the time this happens in our liver. So metabolism is the process of chemical transformation of our drug molecule into its metabolites. So usually liver metabolite or chemically transform the drug molecules into its metabolites for our body to make it easier to manage or make it easier to eliminate. So the metabolism is how our body treating the guest of the drug molecule. So the metabolism is the process of chemical transformation of the drug molecule into its metabolites, which can be easily eliminated or managed. So this is happening inside our liver. So metabolism is the third step, and the fourth one is the excretion. Excretion is the final removal of these metabolites or the drug molecules from our body. So excretion is the final removal. So the excretion is the final removal of these metabolites or drug molecules from our body. So this is the ADME framework. So ADME framework explains what happens to the drug molecule from the moment it enters to the body and until it leaves our body. So it stands for absorption, distribution, metabolism, and elimination. So we discussed each step separately. Absorption is the process of movement of a drug molecule from its site of administration to the bloodstream. Once the drug absorbs to the bloodstream, it doesn't stay there. It circulates throughout our body to reach the specific targeted tissue or the fluid or the place where that it needed to provide therapeutic response. That process is called distribution. Then comes the third step, metabolism. So metabolism is how our body treating our guest. So metabolism is the chemical transformation of this drug molecule into its metabolites. This is usually happen in the liver. So liver metabolized our drug molecule into metabolites which can be easy to manage or eliminate. Then the final removal is known as the excretion. That is the final removal of these metabolites or the drug molecules from our body. So these are the basic four fundamentals of ADME framework. So why knowing this ADME framework is very important? Because to determine knowing this ADME framework is very important to determine the correct dosage, frequency, as well as site of administration. So remember, why knowing this ADME principle is important to determine correct dosage. Correct dosage. Correct dosage means how much of a particular drug has to be taken to provide therapeutic outcome. Correct dosage. So how much of a particular drug to be taken to provide therapeutic response. That is correct dosage. Then frequency. Frequency means how often you should take this correct dosage to maintain the therapeutic level to provide the therapeutic response. So the frequency is how often you should take this correct dosage to maintain the therapeutic level of particular medicine. Then site of administration. Site of administration. So what is the site of administration? To be able to absorb the relevant amount of the medicine to provide therapeutic response. So this under the ADME framework, knowing is very important to determine the correct dosage, frequency, and site of administration. So correct dosage means the correct amount of drug to be taken at a particular time to give therapeutic response. Frequency is how often you should take this correct dosage to maintain the therapeutic level. And site of administration is where you should administer this particular medicine to get the maximum therapeutic response. So This is the all about ADME framework. To summarize, so you can remember we discussed most important two fundamentals of pharmacology, pharmacokinetics and pharmacodynamics. So pharmacodynamics focuses on the drug's action. We discussed it earlier. Then pharmacokinetics focuses on our body response to the drug molecule. So this pharmacokinetic focuses on how or the effect of the drug molecule, effect of the biological system on the drug molecule from the moment it enters to our body and until it leaves our body. To explain this complex journey, we use this ADME framework. So ADME stands for absorption, distribution, metabolism, and excretion. So absorption is the process of movement of a drug molecule from its site of administration to the bloodstream. So once it enters to the bloodstream, it doesn't stay there, it distributed throughout our body, that is known as distribution. Then metabolism is the chemical transformation of drug molecule to its metabolites. So it is usually doing by our liver. So these metabolites is easy to manage and eliminate from our body. So excretion is the final removal part. So that is how we remove these metabolites or drug molecules. This is usually happen in our kidneys through urine. So knowing this ADME framework is very much important for us to determine the correct dosage, frequency and site of administration. So correct dosage is the how much drug you should take a particular time to get the therapeutic response, and frequency is how often you should take this correct dosage to get the therapeutic response. And site of administration is where you administer this medicine to get the maximum therapeutic response. So that is all about ADME framework. Now we are coming to the interesting part of this discussion. So now we are going to discuss two interesting examples to get more understanding about the most important concepts in pharmacology, pharmacodynamics and pharmacokinetics. So we will be going to discuss these two concepts using two interesting examples. So first example is visitor example. First one, visitor example. Visitor example. So we are going to discuss the story of antibiotic amoxicillin capsule. Story of antibiotic amoxicillin capsule. So in our visitor example, we are going to discuss the story of antibiotic amoxicillin capsule. So this is our visitor, the drug molecule amoxicillin. So this is going to be our visitor. This is our visitor amoxicillin capsule. Now we are going to explain our pharmacokinetics and pharmacodynamics concepts using this example. Pharmacokinetics we'll discuss first. It's easier. Pharmacokinetics and pharmacodynamics. So this pharmacokinetics is what body does to the drug, and pharmacodynamic is what drug does to the body. So pharmacokinetics, under pharmacokinetics we are going to discuss what body does to the drug, and under pharmacodynamics we will be discussing what drug does to the body. Okay, now under pharmacokinetics we learned 4 basic principles: absorption, distribution, metabolism, and excretion. Okay, so these 4 concepts we discussed under pharmacokinetics. So now we are going to explain using this example how this happened. Now imagine you have a throat infection. So as a treatment you are taking amoxicillin capsules to treat this throat infection. Now our visitor is amoxicillin drug molecule. Now the first step. Absorption we define as the movement of drug molecule from the site of administration to the bloodstream. Now you can think this visitor, our amoxicillin drug molecule, and our body as the security team managing this visitor. Now what will happen? We take the amoxicillin capsule, we swallow it, and it goes to the stomach and it dissolves, and this amoxicillin drug molecules going to escort or going to enter to the bloodstream through intestinal cell wall. So that is like what? That is like our visitor enters to the building. So it is like visitor enters to the building. Enters to the building. And also we discussed once drug is absorbed to the bloodstream, it's not going to stay there. It is going to circulate. Now the second step, the amoxicillin drug molecules circulating throughout our body. So it is going to our skin, and also it will be going to our lungs, and also ultimately our infected throat. So it's like visitor finds the correct office inside the building. Visitor enters to the correct office. Then third one, metabolism. Metabolism is chemical transformation of drug molecules, making it easier to eliminate or manage. So metabolism is like visitor. Now visitor visits the correct office. Now visitor is getting prepared to leave the building. So it is like the checkout pass is given to the visitor. Checkout pass is given to the visitor to leave from the building. and excretion. The excretion is visitor leaves the building. So now it metabolized, and these metabolites go through the kidneys and excreted via urine. So it is like visitor leaves the building. Visitor leaves the building. Okay, so this is how we explain the pharmacokinetic principles using our visitor amoxicillin drug molecule example. So you can see the pharmacokinetic is all about visitor's journey. Visitor's journey. Visitor's journey inside our body. And also, now we are going to discuss pharmacodynamics. The pharmacodynamic is about what drug does to the body. Now, this visitor has a purpose. Once he visiting the building, he had a purpose. That is visitor's job. So that is visitor's job. So pharmacodynamics is all about visitor's job. Now what will happen? Now drug is distributed and these drug molecules reach us to our infected throat. In our infected throat, these amoxicillin drug molecules find the bacteria which causing this infection. So these drug molecules binds to the bacteria's specific receptors and it prevents formation of cell wall of the bacteria. Then, so what is the job of this amoxicillin? It prevents formation of bacterial cell wall. So this is the job. So amoxicillin drug molecule prevents formation of bacterial cell wall. Then what happened? Then because now the bacteria do not have the proper cell wall, all know that inside the bacteria cytoplasm is very concentrated and less water content inside the cell. So what will happen? This bacteria is going to absorb water. They absorb water and they swell. And they have a very weak bacterial cell wall. They do not have the strong cell wall. Then what will happen? This bacterial cell absorb water, swell, and burst. And the cell death will happen. So once the cell death happen, the bacteria is no longer there. The infection is going to cure. So that is the visitor's job. So the pharmacodynamics is all about what drug does to the body. So in our example, this visitor amoxicillin capsule had specific job to do, that is to remove the bacteria causing this throat infection. So amoxicillin capsule went to the correct place and they bind to the receptors of the bacteria and prevent the cell wall formation. Thereby, the bacteria absorb water, swell and burst, and the infection ultimately get cured. So that is how we explain these pharmacodynamic and pharmacokinetic properties using our visitor example. So this is the story of antibiotic capsule and how these pharmacodynamics and pharmacokinetics behave with this amoxicillin drug molecule. Now we are going to discuss our second interesting example. So our second interesting example to explain the pharmacodynamics and pharmacokinetics is the postal office example. Postal office example. Postal office example. So think about a postal service. A postal service which is going to deliver a letter. Postal service which is going to deliver a letter. So what we are going to explain using this example, pharmacokinetics. Pharmacokinetics and pharmacodynamics. So the pharmacokinetics we define as what body does to the drug. What body does to the drug. Pharmacodynamics is what drug does to the body. So in our this example, we can say pharmacokinetics is like the logistic part. Logistic part. Logistic part where we focus only on how the package is going to pick up, then how the package is going to deliver, and how we are going to remove the empty bins once the job is done, likewise. So pharmacokinetics is about the logistics part. So pharmacokinetics, we discuss the absorption, distribution, metabolism, and elimination of drug molecules. And pharmacodynamics we can think of as content of letter. Content of letter. Content of letter which exactly say what to do when it arrives to the correct place. So we can relate this example. Pharmacokinetics is the logistic part in this example where they only focus on the delivering the package and also how to recycle once the delivery is done. And pharmacodynamics is the content of letter which they are going to deliver. So this content of letter says the job to done, what exactly to be done once it arrives to the correct place. So this is another example we can explain these very important pharmacokinetic and pharmacodynamic properties. Today we have discussed a very interesting topic, Introduction to Pharmacology. In our discussion, we discussed about what is pharmacology, what does this term pharmacology actually means, where did it originate, and also most importantly, what are the basic fundamentals of pharmacology. And we discussed little bit about pharmacodynamics and pharmacokinetics as well. So I hope you learned something from this video. If you find this content useful, just hit the subscribe button and stay tuned for our next session. See you soon.